Welcome, everybody, to Ask Dr. P, presented by Meridian Health and WellCare. I'm Kendra G from WGCI, and I have some of my favorite radio personalities with me. You know him. He's so crazy in the mornings with me on WGCI, the one and only Leon Rogers. Also, my two radio sisters from our sister station from B103, the one and only Bioncé Foxx. And also, we got God in this. You know, we can't do it by ourselves. From Inspiration 1390, the one and only Sonya Blake, and the woman of the hour.
Hey,
Yes,
hallelujah.
the reason that we are all here to ask Dr. Perry. Good morning. Hello, everyone.
Good
Hello, good
morning.
morning.
Yes. Beyonce Fox, you're going to kick us off.
Yes, thank you, Dr. P, for taking your time to help spread awareness of breast cancer. We really appreciate that, not only in the month of October, but all year round. So thank you. My first question is, what are the signs, who is at most risk for breast cancer?
Good morning, and thank you, Beyonce. And yes, we are focused on breast cancer this month, but really, this is something that is a year-round initiative. So the lifetime risk of breast cancer for women in the United States is about 13%. But that doesn't really tell the story because there are significant health disparity outcomes between African American and Caucasian women. So while we have the same rate of disease, the outcome is very different, significantly different. One is that African American women have the highest death rate for all ethnicities. And that high death rate is because there are all these other factors, but mainly it's related to the fact that our disease tends to be diagnosed at a later stage. And there are all kinds of barriers to early detection. They can be cost, lack of transportation, access to care, historic distrust in our healthcare systems. And so what is so important is that we get the word out, that early detection is critical and it makes a difference in the outcome.
Hey, it's Sonya Blakey, Dr. P from Inspiration 1390. How you doing today?
Wonderful. Thank you, Sonya.
Good. I'm claiming the P is power, Dr. P for power, because you are empowering us today.
Thank you.
This great information. But Dr. P, can you share with us some signs and symptoms of breast cancer? I know one of the most common that I'm aware of is the lump in the breast, but I know there's more.
Yes, thank you. And you're absolutely correct. It's that lump that, is very common. But what's also important to know is the difference in your breast. So that can be a difference in the change, in the shape, in the appearance of the breast. We really also look at a change in the skin texture. So we call it pitting. So think about an orange skin that's not smooth but has kind of little dimples. The breast skin can change like that. So it is really, really important that women know what their breast skin, the skin over their breast, feels like, so they can really appreciate any changes. We talk about redness over the skin, but that is where, difference in pigment, so difference in coloring can make a difference. So women who are more darker skin may not have that same reddening look, but it is a difference in that color, in that texture, in that shape. It can be peeling, scaling, crusting, or flaking over the nipple. But again, it can also be that the nipple becomes inverted. And so what is really important is that as women, we understand what our breasts look like, what they feel like, so we can really appreciate when there is a change in the skin and in the texture of the breast itself.
Thank you.
Dot, how you doing today?
Wonderful, Leon. Thank you.
It's Leon Rogers here, and I have a few questions. One, I was asking for a friend, is it possible that you could write a medicinal marijuana prescription plus a week off from their job, a note to the job so they could work on said medicine? And two, the most important thing, how has COVID-19 affected preventive care for some patients that might be dealing with breast cancer?
So Leon, to answer your first question, since it's not really related to breast cancer, for your friend,
yes.
So tell your friend, who I bet is a really close friend, that no, I cannot write that for them to take off work, okay? But I can talk about how COVID is impacting preventive care. And it's a big deal. See, cancer doesn't get a time off. And what we're seeing with the COVID pandemic is that so many people are delaying their cancer screenings, and particularly delaying their breast cancer screenings. So compared to 2019, the data shows that across the United States, breast cancer screening is down by 29%. And we know that people are hesitant. They're afraid. Am I going to get sick coming in to get my mammogram? But this is the thing. What you have is not going to take that break. So it is really important to keep getting those screenings, to keep, get your mammogram. And that's why it's really important that both Meridian Health as well as all of the respective stations here are shining a light on how important it is to keep getting those prevention screenings.
Dr. P, what exactly, I know you just touched on the importance of getting screened, but what would you say? There's so many people who are very skeptical because we are in a pandemic right now to go and get checked out. What would you say to someone who is hesitant right now because of the pandemic to go and get their preventive care?
So providers are doing a lot. When we say providers, I mean hospitals. If you're going to an outpatient facility to have your mammogram, they're doing a lot to make sure that you are safe. So what does that mean? Mm-hmm. You get checked for COVID-19 symptoms. So you will be asked, have you felt sick? Have you had a cough? Have you had a recent fever? Some facilities are checking temperatures prior to doing the procedures. Everyone is handing out a mask. You cannot come into a facility to get your mammogram without being masked. They're spacing out appointments. So you are not going to be sitting right next to someone, making sure, that there's social distancing, both in the facility as well as spacing out between those procedures. And there are all new procedures being put in place on top of the regular cleaning that we would do in between patients. There are now even more extensive cleaning, deep cleaning between patients, because we want to protect, both the patient as well as the staff. So providers, facilities have put in a lot of processes now that are followed very strictly to ensure that you're safe when you come to get your mammogram.
Yeah. We talked a lot about, COVID and breast cancer. And, 8 years ago, my mother actually passed away from breast cancer. So I know firsthand how, even though in a pandemic, breast cancer is something that is still taking lives, even though it's not the top of the news. But I'm so happy we spent so much time in the month of October talking about breast cancer, and just witnessing my mother going through it and unfortunately not passing. I learned a lot about breast cancer. And one thing I learned is early detection truly is key. So when do you recommend patients get tested, and what kind of tests should they get?
So the recommendations nationally for mammograms are that for women aged 50 to 74 who are at average risk, and that's important, is that average risk, that they are screened every 2 years. But if you're a woman who's 40 to 49, you want to talk to your doctor, because the risk really depends on your family. Do you have a mother that had breast cancer or has? And how old was she when she was diagnosed? Do you have sisters? Do you have maternal aunts? In other words, there is that individual risk, which is aside from the screenings. When we talk about screenings, we're talking about a whole population. But when we're talking about what is important for you, the individual, you need to talk to your physician when you're younger than the age of 50 to 74. But aside from the mammogram, it's important to really examine your breasts. As I mentioned earlier, you want to know what your breasts are like. And so that, it is women that often come to their physicians and say, I've noticed something different, and so I need to be checked. And that is not just screening, then that is really looking to see, well, what is that this woman is feeling? Let us evaluate that to see, is this something serious, or is this just part of normal breast tissue? But it is really critical to do at least monthly your self-examinations so that you know what your breasts look and feel like. I cannot emphasize the importance, though, of early detection. It is critical because we're not making the strides for Black women that we should in terms of screening and testing. And we've got to kind of get past a lot of the fears, and we've got to break down those barriers to access and to care, and so that women of color get in to get those screenings.
So Dr. P, can you share some of the fears that women have as relates to, getting those mammograms? I know it took me a minute to get mine because, some women had told me that it's very painful. They squash, they press your breast down like super hard, and it's painful, it's excruciating. What are some of the fears that women face as it relates to getting those mammograms and, early detection?
I think the number one fear is the outcome. The outcome, because most women know someone who has been impacted by breast cancer. And again, there's what I call not the myth, because for some reason, women, it's a little uncomfortable, but what I, would have women tell me, I've heard they smash it and then I'm going to get breast cancer if I get a mammogram. No, you're not going to get it. The machine will not give you breast cancer. And we've come a long way with technique, so we've gotten better at it. And it may be uncomfortable, but it is not painful. But I think the big fear is the outcome. What if I have it? And what I've said is, what if you do? Let's get it early. Breast cancer as a diagnosis is not a death sentence. We can treat it. When we get it early, we have much better outcomes. So I think the number one fear is getting a diagnosis. And, but some of the other barriers are the things that we can do better as a healthcare system and ensure that women have access to mammogram screenings and then break down those barriers to help them get there to get it done.
All right. Thank you so much, Dr. P, for providing this valuable knowledge that we need. And that they say, we perish for a lack of knowledge. So we got a lot of knowledge today. And so we're praying that our sisters and even brothers, take care of themselves as it relates to breast cancer awareness. So thank you so much, Dr. Perry, AKA Dr. P. My name is Sonya Blakey from Inspiration 1390. Shout out to Leon Rogers, WGCI, Leon. And Kendra G, GCI. And of course, Bioncé Foxx from V103. Thank you so much. Ask Dr. P, provided by Meridian Health and WellCare. Thank you so much.
Thank you.